Hello and welcome to November. It is a time where it's getting cooler out. It feels seasonal. It's fall. It's also a little bit of a time for illnesses to make a peek into our ecosystem, which is super fun. But we are here to help you. Today we are talking with Next Level Urgent Care Regional Vice President. Scott is with us and he is going to chat about what to expect in November. We're also going to talk about some really helpful tips and hints on fevers and when you should be concerned. And then we're also going to give you some helpful holiday advice as well, so you can stay healthy and happy through the holiday season. Scott, thanks so much for joining us.
Oh, you're so welcome. It's a pleasure to be here.
Yeah, so you cover how many? You have 11, or you're
So,
about to have 11 offices that you
that's
cover
right.
for Next Level.
Right. So if you were talking to me next week, I'd say 11 officially. So we're opening my 11th location that I'll oversee next week up in the Woodlands, actually. Harper's Trace is what it's called. But currently I have 10 that I oversee.
Okay, and by trade, you are a PA,
A PA,
correct?
yep. That's correct. Yep. Worked in emergency medicine for about 20 years now and came over to the urgent care side with Next Level about 5 years ago.
Right, well, I know they're so happy to have you and have your expertise and guidance. And so, as we're thinking about the holidays in November, and we're starting to hear of bugs and things that
Right.
are happening, let's talk about fevers. What
Sure.
does a fever actually indicate? And then when should we become concerned about a fever?
Right. So, great question. So a fever is our body's immune system responding to some type of illness. And so, typically, when a kiddo gets a cold or a viral illness, then the first thing that's going to happen is the body's going to try and fight that off with its own immune system. And part of that process is raising the body's temperature and giving itself a fever. And so that's actually what a fever is. And it is a very, very common happening when you have upper respiratory infections, flu, COVID, all those things. They all come with that fever. And that means that your body's immune system's trying to fight something off.
Mhm. So, what is the recommendation for handling fevers in kids?
Yeah, well, I mean, first, I think you want to be able to recognize a fever. And I know moms, boom, touch that forehead. I can say that's a 101.6, right? You guys are really good at that. But there's other signs of fevers too when you're not quite sure. Maybe the kiddo was just running around and you're like, well, is he hot or is he not? Is he just, overheated because he's been running around? So there's a lot of different signs of fever actually that kids will present with that we see in clinic. Sometimes it's just a headache. Obviously you get the chills and the shaking, and that's that body trying to raise the temperature. One that I see a lot that's kind of interesting is a kiddo saying that my eyes hurt. You wouldn't necessarily associate that with a fever or some type of viral illness, but sometimes the younger kiddos, they're not going to come and tell you I have a fever, but they say my eyes hurt. So if you hear that, kind of put the radar up and go get the thermometer and check it out.
That's so interesting. My son would always say his skin hurts.
There you go.
Like
Yep.
he didn't know how to say body aches necessarily, but
Hmm.
he's like, my skin feels weird.
Right, right.
Um, and
I mean,
that, and as soon as he said that, I'm like, oh,
yeah,
I call the
something's wrong.
school. Like,
That there's another one that happens a lot with fever, and that's vomiting. Initially that fever spikes up with the immune response, the headache, the chills, my eyes hurt maybe, but also a lot of times nausea, and the next thing you know, here it comes, and it's the vomit, and that happens right when that fever goes up. It's normally not a continuous thing, but the nausea and the vomiting or lack of appetite is another sign.
lovely. Okay. So
Yeah.
I'm we're kind of going to go off the map for a second.
Yeah.
What do you think is the best thermometer for moms to have on hand? Do you like oral? Do you like the forehead? Do you like the ear? Do you have
So So I
recommendation?
love the digital ones, the digital thermometers, because they're very useful. Because sometimes it's so difficult to get it underneath the tongue. So putting
Mhm.
it underneath the arm, and typically you add a degree if it's underneath the arm. But the bottom line is you're going to know that the child has a fever underneath the arm once it gets to 100 or 99 or something like that. You're like, okay, this is definitely a fever. But the digital ones, they're cheap. You can get them on Amazon same day delivery, and they're very easy to use and accurate. Sometimes the tympanic membrane ones that you put in the ear, they rely upon hitting that tympanic membrane. If there's wax in there or other things, they can be inaccurate. Same thing with the forehead, like we said, if the child's running around, then it may not be as accurate. But a good old fashioned digital thermometer is readily available, cheap, and accurate.
Okay. I heard it here.
There you
And
go.
so I always struggle because like we'll do like both. We'll do like the ear and
Right,
the
right.
forehead, and we'll be like,
You take the
do you
average, right?
like take the average of the
Yeah,
two?
right, right.
Um,
Perfect.
when should we be super concerned about fever? When is the time to come see you guys at next level?
Well, I think anytime a child has a fever, I'm not going to tell you to run to the doctor immediately. I know my mom certainly didn't. She would say, "Go to your room and here's some Tylenol, suck it up, you'll be okay." But we have a lot of testing now, and part of knowing that the child has a fever is then wanting to find out, well, what's causing the fever? Is it strep throat? Is it a viral infection? Is it pneumonia? Is it an ear infection? So that's where we come in is we have a lot of tests in the clinic and we can test for those things and evaluate the child. Now, 9 times out of 10, we're probably going to tell you, okay, good. This is a good old fashioned fever that comes with an upper respiratory infection, the kinds that are spreading around the school right now. But there are certain illnesses that we have certain medications for. You may need antibiotics if it's strep throat, or if it is influenza, which we're expecting to see an uptick here soon, probably unfortunately, there's antiviral medications like Tamiflu that we can prescribe if we catch it really early. So do you have to run to the urgent care if your kiddo has a fever? No, but we do have testing available. Now to answer your other question, Megan, about when do we know if it's bad or not, right? As far as okay, this is more serious than mom telling me to have some chicken soup and go to my room. Um, so I always like to test it out with medication. And what you should see is if you give the child Motrin or Tylenol at the appropriate dose, after about 35 minutes to an hour, they actually should kind of return to baseline and almost be acting themselves again. Not 100%, but when that fever first goes up, the kiddo's just pathetic. They come to you and they're just mopey. They want to be held. But after you give the Motrin and Tylenol, I like to see them turn around. And in an hour, they come back and they're looking at you. They're almost acting themselves at that point. And don't worry, you can still bring them to the clinic, even if the fever goes down. You don't have to prove that they have a fever. We trust you that they had a fever and we can still test them. But I like to make sure that they return to baseline or close to baseline after the Motrin tunnel. That's always a really good sign.
Okay. And that makes sense because whenever I take my kids with fever, they're like, well, when was the last time you gave a dose of
Right,
any sort of, um, fever reducing medicine, I guess.
right, exactly. Right.
And so then you guys can kind of backtrack and make sure it's not. I do love that you guys have all of the testing. Um,
Hmm.
I don't know on a scale of 1 to 10 how much you judge me that I want it to be strep or something I can give an antibiotic for.
I get you. I understand.
Because there's most of us moms are like, we don't want to hear the dreaded, it's just a virus.
I know. I know. I
It's
understand that.
it's like it's just hard to, it's not as palatable. But speaking of viruses,
Hmm.
what are we seeing? What are we anticipate seeing in clinic over the next month or two?
Right. So unfortunately, the Southern Hemisphere, it looks like they had a pretty strong flu season this year, and we normally follow that trend. So, and not always, but it is an indicator that we may have a pretty robust flu season this year. We're not seeing it in the clinic yet, which is good. But what we're seeing a lot of right now is upper respiratory infections. So that can be caused by influenza, can be caused by coronavirus, adenovirus, rhinovirus, RSV. All of those things can cause those same symptoms that we're talking about: the headache, the fever, the sore throat, runny nose, cough, body aches. And like you said, unfortunately, we treat them all very similarly, but it's really important to listen to the lungs, make sure that there's no evidence of pneumonia. We have chest x-rays at the clinic too, so we can make sure that it's not something more severe. We do have RSV testing at the clinic as well, to know if it's RSV, which is important, especially around little ones. If you have, newborns in the house or anyone under the age of 2, then that would be something very useful because RSV can be very dangerous to that age population.
I didn't know that. I think that's so, so important. And as we kind of think back to early summer this year,
Hmm.
um, there was a virus that was like turning into pneumonia
That's right.
wild
Yep.
in wild amounts, and my son got it. And his I went in and I kind of had the backstory that I knew it could turn into pneumonia. Sure enough,
Right.
we went back like 5 days later, pneumonia. So things that are important to know. So like
Hmm. Exactly.
and you guys do the chest x-rays, right?
We will. Yep, we will. That's right. We'll do the testing. We'll listen to the lungs. And if we hear any abnormal, sounds with the lungs, or in your situation, if you're coming back after 5 and 6 days and you said, okay, you guys said it was just a virus, let me take some symptomatic medications, Tylenol, Motrin, let it run its course. But it's
Yeah.
been 6 days and I don't think my kiddo's getting better. Bam, get that chest x-ray and let's see what's going on and make sure that you're exactly right. We did have that run of pediatric pneumonias recently. And so we're always on the lookout for that for sure.
That was a wild time. I'm like, this is not how we start summer in Houston.
Yeah,
This
I know,
is
right?
not fun.
Summertime.
This is not
Exactly.
fun. So as we start holidays in Houston,
Hmm.
what are kind of like your best, how do we stay healthy? I mean, obviously there's the washing of hands and whatever, but there's
Right, right.
travel happening. Like what gives us our best chance to dig into the turkey and the dressings and all of that?
Well, well, Megan, nobody likes to hear this when I say it, unfortunately, but or maybe they do like to hear it. They just can't avoid it. But in my experience and in the literature, stress is really one of the worst things for our immune system. And I see it over and over again where I think that my patient should be getting better. And
Mm,
I look at them after 4 or 5 days and I'm going, what's going on right now? And they look at me and they tell me, I got family in town. I haven't slept. My kiddo's sick. I have a project at work. And bam, there it is, right? I mean, they are so stressed out. And so, stress is really the number one thing that we can try and avoid to help our immune system. I
mm.
mean, I don't mind writing a prescription for it, no stress at home, right? Why not?
Yeah.
So, or work or whatever. But it really is, people undervalue that, but it is so important. I can't tell you how important it is to rest, drink plenty of fluids, and have your immune system be at full strength to in order because you're going to get exposed to it at these family
Yeah.
gatherings. You can wash your hands, keeping the hands out of the face. Don't touch your face before you go get the bunch of chips from the bowl. Make sure you wash your hands first, and everybody else does. But you're going to get exposed to it. So make sure your immune system is top notch.
I think that's such good advice. I've done a lot of these videos, and stress is a very we don't mention it much because I think we just kind of take it as our life, like
It's
it's
part of life,
going to
right?
be stress. And
Right, right.
um so I think like maybe little things like take a walk at night every night.
Exactly.
Just, you know,
Yep.
just try to chill.
Exercise is key.
Yeah.
And just getting your mind out of that horrible area of all the things that you have to do and all the people asking for things, right? So,
Huh.
yeah,
Take a
it's really
break
important.
from this.
Exactly.
I mean,
I
Aunt
try
Stacy's
to.
gonna get what she gets for Christmas, you
There
know?
you go. That's right.
You're gonna write me a prescription after this,
You
right?
got it. I'll send it electronically.
Perfect. Anything else that we should be mindful for the holiday season or anything else you want to add about Next Level?
Well, I mean, I will add, of course, we have 28, 27, 28 next week locations all around Houston, and it is our busy time. but that's why we have the app so that folks can get on and see if there's a line and they can get in line and they can get a text message that says, hey, your room's ready. Come on in right now. And so take advantage of the app. Come see us if you need us. We want to make it seamless. And, we want our patients to have an incredible experience when they're there, from the app all the way to the discharge instructions and the follow up. Being able to call or reach someone on our app and say, hey, I'm not better. Just so from A to Z, utilize every resource that we provide and let us keep you healthy.
Yeah. Great advice there. I will say I'm personally like an updated member of the app. So
Nice. Yeah.
if
Make
you
sure you update
have,
it.
yeah, if you have the Next Level app and you haven't upgraded in the past, I would say y'all rolled out a new one about a month ago
Yeah.
or
A month and a half ago. Yep. Yep.
and so go ahead and get it updated now.
Right.
And then when you're not in like the stress of the sickness, you have your app fully updated. But I love that because I love the app that I don't have to go sit in what could be a germy environment for
Exactly.
longer than necessary.
Right.
So utilize that, utilize them. They are open 7 days a week, 9
Mhm.
a.m. to
Nine to
9
nine.
p.m.
Yep.
And there's 28 locations, y'all, in Houston. And then they have additional locations in San Antonio and Austin. So if your travels for a holiday are taking you over to our west, you can probably find a Next Level over there as well. So um, we
And then
just
Beaumont, Nederland, right? If you're going east to Louisiana for the family
there.
members,
Okay, yes, I forgot about the
stop
other
in Beaumont.
the portion of your territory. Yes.
That's
So
right.
almost to Louisiana, you can
That's
go to
right.
Beaumont location that Scott also supports out there. So
Mhm.
um we are so thankful for Next Level and their partnership with Houston Moms. It is our goal to keep you happy, healthy, and safe this holiday season. We are going to pop links below and that has all of their locations so you can find one near you. Then we'll also put in where you can get that updated app so that you have everything at your fingertips. Scott, thank you so much for joining us today.
Megan, thank you. It was my pleasure.
It was awesome. We will be back in the new year with some more health tips from Next Level Urgent Care. Until then, I can't believe I can say this. Almost happy 2025. We're almost
Crazy.
there. Y'all take care.